IBS versus IBD. What is the difference? Well, they sound almost the same, right? And there are many similarities, but there are also some key differences. So let's explore IBS and IBD and create some clarity around these two similar but different terms. Now, IBS stands for irritable bowel syndrome. IBD stands for inflammatory bowel disease. The names can be very confusing because they sound very similar, and there is a significant amount of overlap between the symptoms of these two conditions. Both can be considered diseases, even though one has the word disease in its name, and both can include inflammation, even though many people think of one as the inflammatory condition. However, you want to make sure that you're using the proper term when you're referring to these two conditions, because they really are two different and mostly separate conditions. Diagnosing IBS versus IBD. Now, the key to separating these two conditions occurs when you have a colonoscopy, which is usually with a gastroenterologist. Those are the doctors who perform colonoscopies. A colonoscopy is the process of having a colonoscope, which is a long, flexible tube, right? It's not unlike the cable of your cable TV that you've seen. Only in this case, the cable has a light and a camera on the end of it. Well, it's that cable, and it's stuck up your rear end, right? And during a colonoscopy, your doctor can see what the inside of your colon looks like, as well as take biopsies. These are little tissue samples from the side of your colon. Now, if your colon is significantly damaged, meaning that there are visible ulcerations in there, so when the gastroenterologist is going in there scoping and looking, they're seeing the ulcers, right? They're seeing damage, or they're seeing severe inflammation on the biopsy that they've taken. When that happens, then you're likely to be diagnosed with IBD, inflammatory bowel disease. If there is no big obvious damage, right, no big ulcerations, then you're likely to be diagnosed with IBS, irritable bowel syndrome. IBS symptoms versus IBD symptoms. Now, IBS and IBD can both cause diarrhea. They can both cause abdominal pain, even severe abdominal pain. They can both cause constipation, gas, or bloating. IBD often includes weight loss and fatigue, but those symptoms can also be seen in IBS. Now, the key difference with IBS versus IBD is that IBD will often cause bloody diarrhea, whereas IBS will only rarely cause blood in the stool. And the blood from IBD, inflammatory bowel disease, comes from those ulcerations that might be seen during the colonoscopy. Now, what people often perceive about IBS versus IBD is that IBD is always worse than IBS. However, that's not necessarily true, and it's relative to the person experiencing the IBS or the IBD. Now, let me give you an example, because either one of those can send you to the emergency room. And the severity of the symptoms for IBS and IBD run the spectrum, like the full spectrum, from mild to very severe. And mild cases of IBD can be far less severe than bad cases of IBS. And I've seen many patients who've had IBS who've been in the hospital multiple times for their pain and for their IBS, and been way worse off than a lot of IBD patients that I've seen. So they definitely run the spectrum. How to tell if you have IBS versus IBD. Now, the only way to know for sure if you have IBS or IBD is to see your gastroenterologist and have a colonoscopy. There is no definitive test or way to tell the difference without a colonoscopy, even if you have a lot of blood in your stool, because there are many other things that can cause blood in the stool. And your doctor's not going to know either. They're not going to know the diagnosis until they do a colonoscopy and maybe even run some other tests to rule some other things out. So if you do have IBD, depending on where those ulcerations are occurring, you can have either one of two types of IBD. Now, those two different types of IBD are known as Crohn's disease and ulcerative colitis. Can you have IBS and IBD at the same time? Well, you can in fact have both IBS and IBD at the same time. If you have both, the IBS component is often not diagnosed until your IBD goes into remission. Because when this happens, the ulcerations are no longer seen in your colon. However, you may still be experiencing digestive symptoms. And if that's the case, then the question is, why? Right? Because the IBD seems to be gone. Now, in that case, you probably also have IBS. Now, having both IBS and IBD probably happens far more often than most people realize because it can be difficult to separate the two, especially when the IBD is mild or it's in remission. Now, it's always smart to see an IBS specialist and get that aspect treated and solved because it may end up helping you with your IBD. At the IBS Treatment Center, we've often found this to be true, so we encourage you to schedule an appointment. Although it has long been thought that IBS does not lead to IBD, recent research suggests that it can, and that the two are even different points on a spectrum of digestive disorders. Either way, there is a great deal of hope for people suffering with IBS or IBD. Conventional medicines tend to only treat the symptoms, however, which can be important, of course, in the short term if you're suffering with IBD, but dealing with the underlying ecosystem of the digestive tract can lead to a much better outcome and much more long-term relief. Do you have IBS or IBD? And if so, what are you doing for it?